Our final speaker this afternoon should be known to many of you here and the home audience in the room, is Andy O'Hara. And Andy has worked for over 10 years in the community as a community worker. He has a passion for creating and making sure the most marginalised voices, oppressed and those excluded from power, that the conditions are in place for those and their voices to be heard in programmes, projects, research, policy, strategies and ultimately in decision making. Andy currently works in UISCE and he currently represents UISCE on the National Oversight Committee, and I've had the pleasure of working alongside of Andy and knowing him in the National Voluntary Drug and Alcohol Sector and the National Oversight Committee. So Andy's going to talk to us now.
Right, well listen, I've been told to be quick, and no, we agreed that because it's a really good conversation we're having and we've had some excellent contributions, but I think when we're talking about participation and we're talking about engagement, it'd be fantastic to hear some of the views and opinions of some people in the room. So look, you know I work for UISCE, I won't go on about that. Peer-led research, peer-led participatory research, like how and why. Okay, like I think everybody in the room here would be aware of our national drug strategy, reduce and harm, support and recovery. And there's two really important components of that from our view. It's the fact that it talks about a health-led approach, and it also prioritises the participation of people who use drugs. And we ask ourselves, why are they in there? They're in there because the evidence supports that. And we also know that, like any good policy that's being developed, it's because we know previous policies or previous social policies probably haven't worked as well or probably have failed. And when we look back at previous policies, I think there's I think we all agree, different stakeholders, that some of the policies in the past failed because they didn't have the voice of those most marginalised, that those most impacted represented. So because we have a national drug strategy now and an ever-increasing drug policy focus, that means there's an ever-increasing amount of research being done. So the question is for us always, how inclusive or what's the level of participation in that research? And I think when we always have to ask ourselves why, and especially with the people, we're working with some of the most marginalised people in the country or in our states, in our communities, and what people sometimes fail to realise is it's people who use drugs have expertise and invaluable experience that will only strengthen all aspects of the work. And I think in light of what we've pointed out is in the National Drug Strategy, it's no longer really a question. I think there would have been a time where people would have assumed that people who use drugs didn't need to have a voice or hadn't got the capacity to have a voice. But I think what we see now in projects and programmes, in policies and strategies, in research, is everyone realising that there's a need to have the participation of people who use drugs in those spaces. I think, what do we know? We all know, and this is all evidence-based, you know, and from our own experience, when we prioritise the inclusion of those voices, we always achieve the greatest outcomes. And I think we regularly engage with people who, like, whilst they champion the fact that we have this stuff in our strategies and in our platforms, we also probably need to critically analyse how far we are along with those methods and those practices, because I think it's fair to say when we're engaging with people ourselves and through other organisations, the experience of people is that they aren't being listened to, that they've been excluded, not just from research, not just from projects, but from policies and strategies. So over time, throughout their lives, people's experience is one of not being heard. So we need to look at research in particular, because research is a really good opportunity to give people the voice and give people a voice in a process that can help them lead to being involved in change. So I'm struggling to read this, but I'll do my best. Research for us is really important because, you know, we work on many different aspects of the work and many different methods, and we're always looking at research as an actor for change. And I think we need to have ownership over that, because there's a wealth of research being done, and we need to be critical about how good the research is and how much of an impact it's having, you know. And I think once we do that, we can start to see research as another resource that we can open up. You know, we need to see research as a tool to give people a voice, as another process that we can involve people in, you know, as opposed to maybe a piece of research that happens far away from them, that it has to start with them. And we will always say that it's peer engagement that leads to peers being involved in decision making. So we regularly ask ourselves, where are the peers? Our peers at our platforms, our peers involved in our strategies, our peers involved in our policies, and we struggle to come up with solutions as to, or answers as to why they're not there. But a lot of the time that starts with peer engagement. So what are our processes of peer engagement that leads to peers being involved later on? And one of the key pieces of that is research. So we need to look at research again and look at what's the peer-led element of it, or is it just peer involvement? And we'll go on to the next bit. So peer partnership, peer-led process, like what does that process look like? And I think the first part of that process is acknowledging that people who use drugs are experts. I think a lot of the time when we're talking about research, we have many different other people who are experts, whether it's researchers, whether it's policymakers, whether it's organisations, whether it's people like myself. But what we really need to do is get used to shaping whatever it is we do around the people who have the lived and living experience. And even just on that lived and living experience is really important, because I think even within that, what we can sometimes end up with is people who have lived experience or people who used to use drugs, who have a really valuable input. But we always need to seek out the people who have current living experience, the people who are currently accessing service, and even sometimes people who aren't accessing service because they're extremely marginalised. And I think when we create research processes that are open and accessible, what we do is we create the conditions for people to develop their own analysis through their own lived experience. So we're trying to create spaces that are safe for people to come in and explore the issues and develop their own analysis, but based on their own lived experience. So it's very much a space where their lived experience is the priority and their lived experience is most valued. And I think once we do that, we can build relationships, confidence, self-esteem, because I think these are all things that are prerequisite for supporting people in being involved in research and other opportunities to access, access for opportunities to be involved. And I think one of the things we need to do, we often talk about, we talk about PPI, and it's some really fantastic examples of PPI out there, but sometimes they're pre-designed to suit people who have probably already engaged with setups, with platforms, with structures. So, we really need to be able to critically analyse all the structures that we're involved in, because a lot of the time some of the structures we have would be designed by people who have probably less experience of marginalisation and more experience of being heard, whether they have a particular view around an issue, but they might fit comfortably into some of our platforms and some of our structures. So if we really want to support people's access and support people to be involved around research, we have to really support and promote research structures that are open and accessible. And I think once we do that, what happens then is we start to formulate strategies that can go beyond consultation and really create a policy context for full participation. We always say there's two things we always want to look at, is the process and people. And I think sometimes we focus on the structures and we focus on the platforms, but we always want to start with people and the process. And as I said before, it's the process of peer engagement that leads to peers being involved in decision making. So when we're looking at our processes around research, we need to see, where are the people? Is this being designed and shaped by people who use drugs or around people who use drugs? Or have we already designed the process, and have we already designed the structures, and are we asking them to be involved in it? So we always want to be looking at our research process and is it linked to our task. As I said previously in relation to the National Drug Strategy, we're all here because we believe in social change. The drug strategy is there to achieve social change, but we always need to be looking at the research as the process of giving people that voice. So if we're looking at our research process, what does it look like? Does it have as a prerequisite opportunities for participation, for empowerment, for collective action, collective decision making? Because I think if we don't critically analyse our methods, what we end up with is tokenism. But we always need to be working towards full participation. And sometimes it's okay to say, right, you know what, we're somewhere in the middle. And we do that all the time in our organisation, because I think sometimes it can be challenging as an organisation or researchers or policymakers to, we want to be able to say, and we want to be able to be seen as someone who has full participation. But it's okay to sit down and say, look, we'll do it regularly, whether it's a piece of research we're involved in, a programme, a project. We'll look at everything, a piece of outreach, and we'll say, where are peers leading out on that? And sometimes we'll say, no, they weren't. Where were they? Well, we kind of designed the whole thing, and we got peers involved afterwards. and then we'll just reevaluate that at the next run. So I think it's okay for us to get into a place where we're open to analysing and critically analysing our own spaces. I have two statements that I'm going to read out today, and they were both written by a small group of peers that we have going at the minute. And the group is really, at the minute, is set up with folks and looking at what are the funding opportunities, and you know, what role can peers play in developing and accessing funding opportunities. And it's important to say that group is part of a wider process of peer engagement. So it's developed from our outreach, it's developed from our groups, and through those mechanisms people build confidence and they start to realise that they have a voice and they want to be more involved in other things. So that group, for example, would have said we need to start looking at research, and it's worth saying that group has a mixture of people who have different current experiences of using drugs, of accessing services, of issues with social services, with homelessness, and also largely criminalisation and stigmatisation. So they've a vast level of current living experience. And what we always try and do in our organisation, and especially with this piece of work around research, we're always trying to, as I said, trust people and trust the process. We're always design and shape something around groups of people. So when the topic of research started coming up, we said, well, let's start having a discussion with this group of people and with relevant researchers. So we put together a small, I wouldn't call it a research committee, but it's a group of people, and it's a group of peers, it's ourselves, and it's two researchers who have done research around drug policy. And right now, the discussion is really based around some of the stuff that's coming up is what's coming up is based on their own living experience, but also based on outreach that they're doing with peers at the minute. And what's coming up for them is they're looking at 3 drugs. They're looking at crack, they're looking at opioids, and they're looking at tablets. And they're looking at what are the issues for people who use drugs, what are their needs, and what are the responses. So that's only where that question is at the minute. It hasn't refined itself into a specific research question. That's the first thing they're looking at. The second thing is, how can we ensure that it's a peer-led initiative from the beginning to the end? And the third part is that how can we ensure as a group that when we do develop findings or do get recommendations, that we create access to the relevant stakeholders? Because an important part of the process, if you do it right, should be that the peers who are being involved from the beginning to the end will have the skills and the ownership to be able to go out and deliver this piece of work. So you're talking about a strong process from the beginning. I think that can be challenging sometimes to look at it like that, because I think if we look at how funding is derived or some of the funding structures, a lot of the time the research question or the funding mechanism happens far away from the people who are most impacted. So you might have a research question that's developed, there'll be a funding mechanism, a researcher will access the fund, and then they'll come to us and we'll access some people. So what we're really trying to do there is start at the very beginning. Start at the beginning and democratise the whole process, ensure that people are involved in the whole design and delivery of the research. Now that presents challenges because we don't have a specific piece of work or a specific piece of funding for that piece of work. But anyway, I'll read out a statement that they came up with, which describes that. A strong process can democratise knowledge by involving peers in the research itself, and can promote social transformation rather than simply generating knowledge or the acquiring of knowledge from a particular group, which limits their ownership over what is produced and possibly the efficacy of what's produced. So let that sink in. It's a bit of a mouthful. So when I mentioned this briefly earlier, but I'll go into it again, the spectrum of participation. Every time we go into a piece of work, and specifically now at research, we'll look at it and we'll say, right, where is it on the spectrum of participation? And what are the practical steps we can take to move up the spectrum of participation? And it's really important to mention this as well, you know, when we're working, especially with drug policy and research around drug policy, you're really working with some people who are some of the most oppressed and marginalised communities, you know, who have been excluded in their own view and their own experience from society and decisions for most of our lives, you know. And a lot of them, their personal experience would be one of, you know, in many ways that decisions around their lives have been, there's been a holding of power of decisions around their lives for a lot of their life. You know, we have working with people who are probably, you know, they probably have poor levels of engagement with school, with the police, with social services, with services in general. and even sometimes with GPs and doctors, where they might not even feel like they have a voice in that care plan. So you're really, when we talk about targeted interventions, we have to recognise the barriers that some people face in regards to engaging with some of the previous structure that we've already designed. Because we know that people who use drugs in their experience usually have no power in some of the personal decisions from their care plans, and they'd see that transfer then all the way up to policy. So we're really looking to address that balance. So address the unequal access to power, and we can do that if we democratise the process in our research model. All right, and that involves, as I've just explained, all we're really doing there, while it might seem a bit radical, it's not really. All it is from the beginning sharing the power. So from the beginning saying, right, what is the question? What's the process look like? And allowing them to feel like, right, we really believe in you, and we believe that you have valuable information and valuable answers that can shape this whole process. Because I think what we've seen in the past is the development of solutions without peers will perpetuate marginalisation and injustice already faced. And we see that over time, particularly with extremely marginalised groups, that there'll be sometimes, as stakeholders, we might say, well, peers aren't engaging with our policies, they're not on our platforms, they're not in our research because they won't engage. Why is that? And sometimes we'll convince ourselves because they don't want to have a voice, or that they're not in a position to have a voice. And it's really that what's normally happened is that, their experience of engagement has been poor, or what they see is years and years of research and years of policy, but they don't feel like they've ever been really included in it. Now, what we have there is, I talked about the spectrum of participation. So this is kind of a little bit of a graph that describes that process, right? I won't go into it in detail. Because again, looking at piece of research that you're involved in, I think it's up to everyone in this room and beyond to start asking ourselves, like, where were we on the spectrum of participation? And if you were to look at, so I have one of them there. So under consult, in the middle one, we have information from peers will be collated, concerns will be taken on board, and feedback will be given about decisions taken. Now, it's important to note, I think we've come a long way, because I think maybe 20, 30 years ago, research was just being done for people who use drugs without them. And I think now there's a recognition that has to change. And there's some really fantastic pieces of research that's taken place in the last couple of years. I know we've been involved, we've supported some research in doing them. And sometimes that will break down to, it might be a questionnaire, it might be a survey, it might be interviews, or it might be focus groups. And either of those have varying levels of participation. But going beyond that, and if we want to be really, really, really ambitious, we need to be saying, look, where were peers in the decision making of that whole process? And if we look down to collaborate, what you'll see is we will work in partnership with peers to formulate collective decisions, and then empowerment, we will implement what peers decide. So asking ourselves in our research, are we looking to include them in a piece of the process which is really valuable, or are we going to be ambitious and we're going to say we're going to work in partnership with them on all of the decisions that affect this piece of research? And then if we're going to be really ambitious, are we going to really seek and set out to implement what it is the peers decide? This is a graph we developed in UISCE, and it describes the process that I'm talking about. And I suppose, the work is always about a task and a process. And as we said, we're all here to deliver on the task of the achievement of social change. But the process is where all the stuff happens. It's where all the magic happens. And our processes have to be set up to promote empowerment and collaboration. And if we do that, then we start to get in our groups, in our research, you'll start to see people be involved in collective decision making and collective action. And that then moves us up towards peer-led. So if we're always looking at our research in that model, like where were the peers, were they there from the beginning? And then what you'll see over time is, more importantly, what we want to see is, we want to see peers being in a position to deliver this information. Like, that group that we have currently running, if that continues to operate and that continues to work the way it is, I won't need to stand up here next year. They'll come up and they can talk to us themselves. Because it's really, it's not just about getting people's opinions and getting people's views. It's creating the spaces for them to be leading out and delivering the information that's relevant that we need to hear. So I'm nearly finished, don't worry. So just to recap on a couple of things, you know, it's about focusing on the process. As I said before, focus on the process and trusting people, and ensure that there's a real collaboration on the design, delivery, and the evaluation of the research. And I think what we do then is we're always encouraging and we're creating the space for people to critically analyse the issues through their own lived experience. And I think once we do that, in our experience, and I've other examples there, but I won't have time to share them, you end up with really innovative and creative approaches. Because when you hand over power and you hand over the space to people, you really see their creative side come through, and you see the value in having people at that table. And I think once we do that, you get a really strong collective analysis of the issues, because what you get is a transfer of knowledge between researchers, between policymakers, between people who are most affected. And I think then what you start to get is something that we always want, and it's the collective outcomes for people who use drugs, communities, and society. I will probably flick through this because I'm rushing through time. I'll go through the last two slides. Look, what happens when we do this? We know from our own practice and all the international evidence and national evidence and stuff in this country, the outcomes will always be better if we have a stronger process. So again, going back to that, having a strong process linked to the task, we'll end up with better services, and they'll be responsive to the needs of peers. Very importantly, we'll address equity issues, and we'll end up with really equitable and fair policies, because I think we'll all recognise that a lot of the people we're working with come from environments that have probably suffered because of unequal opportunities and unequal outcomes based on some unequal policies that have been developed maybe 20, 30 years ago. We'll end up with increased and improved access to services, which we all want, and better health outcomes. And essentially, to describe the work, what are we trying to do? What we have here is we have policies and policy makers, which are actors of change, which includes research. And then what we have here is we have people who use drugs, or people who are extremely marginalised. So it's how do we close that gap? So the process is how we close the gap. And one of the key areas and key actors in that is research. Research can bring people from having no engagement to having full participation. So it's really important we recognise the value of that. So to capture what I've said in 3 points, it's to continue to create the conditions for peer-led research. Peer-led research has to be a priority. And if we do that, what we're doing is we're creating research that allows us to share power and then create research that informs actions that deliver. And in that process, what you get is you get a promotion of leadership, of ownership over the research, and activism. You get people who are ready to be active in challenging some of the stuff that they see as unequal in our communities. And this is the last statement that was developed by the group I was telling you about, and I'll just read it out, right? And they were pretty passionate about this. It took us a couple of sessions to come up with this, and I'll just read it out. So, we know how to achieve change. Change has been achieved, but we have to be ambitious. We have structures, policies, and research opportunities, but we need to ensure they provide genuine partnership and focus on a process that promotes participation and leadership, which ensures the voices of those who are saying they feel cut off and left behind, included, and driving the implementation of research and actions, which promotes the expert role people who use drugs have in driving the change we all want to see. So I'll leave it there.